Hi, this is Margaret Murphy and I'm the coordinator of the HHT Centre in the Mercy Hospital in Cork. I'm just going to speak a little bit about what we do and how we do it. This is the address of the centre and my email address is margaretmurphyhht@gmail.com. Margaret at hht.ie is no longer active. The number to call, it's a voicemail and it's 021 493 5575. This is just a voicemail, as I said, so the best way of contacting me would be to email me at margaretmurphyhht@gmail.com. If you can't do that, just leave a voicemail and I will get back to you as soon as I can. But the best way basically is margaretmurphyhht@gmail.com. The previous number is below, but that's not in use anymore. The information that we need at the first contact are as follows: name and address, date of birth, your email address, your telephone number, and ideally mobile if you have one. GP's name, medical insurance or not. If you have medical insurance, what insurance is it? It doesn't make any difference when you have your screening done, whether you have medical insurance or not. It's just boxes basically. And then let me know why or how you made contact. Was it because a family member came to us with HHT, or were you advised by your doctor, or from the website HHT Ireland, or internet search, or some other means? When I call somebody, this is the information that I need. So we talk about personal, family, medical history related to HHT, if you have any signs or symptoms, and if some other family member that you know of have HHT, whether they've come to us or not, and any previous treatments or investigations. The appointment for screening, I will send out an appointment to you with the date and details on it. The whole process takes at least 4 hours. It's usually Tuesday or Wednesday mornings and starts about 9. I know this is not ideal, but it's not my choice. So it's a bit early for people travelling. It's a bit early for anybody. If you're not part of a family we already know, could you get a referral from your GP? Just a quick letter saying, just referring you to us. Sometimes the hospital contacts patients, particularly because of COVID, and they may tell you to go to outpatients first. Basically, don't. Your first protocol is cardiology, which is in the fourth floor. And don't wear any heavy makeup or foundation. This just covers the skin and it makes it more difficult to see the telangiectasia. When you come to the Mercy, as I said before, the first place to come to is the cardiology department, and that's usually around 9 o'clock. And there you'll have an IV line put in for an echo bubble. This whole thing takes 10, 15, 20 minutes. And then depending on the results of the echo bubble, that'll decide the next step you take. Now, Aidan will talk more about that in a few minutes. If the echo bubble is positive, we would organise for you to have a CT thorax, and that'll be done on the same day. And then your MRI of your brain, which will be later on. Usually that appointment time-wise is usually kind of early afternoon. Sometimes they can bring people in a bit earlier, but I'll explain all that anyway when you visit. And in the middle of all of this, you'll be seeing Professor Terry O'Connor, and he will have a chat with you and he will decide whether to do blood tests or genetic testing or both. This is the echo room, and this is where you'll be having your echo bubble. And that's the couch where you will be lying on to have your echo bubble. And the two images below are pictures of your heart that we would see when you're having an echo bubble done. And I think that's all. And I'll hand you over to Adrian now.